One thing that we know is those that were most affected had the highest incidence of chronic disease. So I think if we really think about the post-pandemic world, we have to really think about how we control, how we help, how we support those that have chronic conditions.
There's no transparency. I mean, zero.
The dreams we have constantly as we think about this world is the concept of personalized medicine, where we can really get more targeted in on what works for each of us when it works. And so we can have a little bit more of a targeted benefit. We can have a little bit more targeted coverage. We're not trying to cover everything for everyone at the same time.
All the other advantages that there are for coming onto online digital health programs, that we need to figure out how to integrate those better into a holistic approach for our patients.
There's lots of people who are struggling to make ends meet and trying to figure out how they can pay for all their bills and get insulin.
Insulin costs have flattened, but they've flattened from the patient perspective at the top of the mountain. What we're told is the cost when we are with the patient, sending them on their way, is not the actual cost when they get to the pharmacy counter.
I think we all know someone directly affected by this chronic disease and the challenges they face every day.
I am keenly aware that the cost of care is a continuing challenge for the 122 million Americans living with diabetes and pre-diabetes.
Families are being forced to decide whether to put food on the table, whether to have housing, and it is really, really a problem.
Living through the challenges of raising a child living with diabetes has made the issue very important to me, but it's also made it very personal.
%25 of the beds right now in most hospitals have people with diabetes in them. That's huge. That is a very significant statistic. That is a lot of folks.
Unfortunately, to me, as a young person with diabetes, it seems like so often when we're focusing on diabetic patients, we're talking about people who are on Medicare or who are older. And there's so many of us that are struggling, that are young, that simply wouldn't qualify for anything like this.
We have folks who do not engage as much and they do not understand it. And so it comes on us, and how do we make it available to them in a language they can understand, in a way we can help them.
Step therapy should be abolished. I mean, if there's anything that I've learned from Matt, it's that anytime there's any barrier, any instance where someone might have to make one extra call to their insurance to chase something down, it's just another chance for them to fall through the cracks.